Happy Monday, Jaden Weibel. Today we're going to kind of talk about what we're going to do in this class. Each week we're going to, well, really probably every 2 weeks, you guys are going to create your own Google Slides presentation about a different injury. And then when we come together to do our Zooms, you guys will basically present to each other. So that way y'all can learn a little bit more about the body, kind of go more into depth of what Miss Lotta did for y'all last year. So I figured the way to start it would be to show you guys an example of what I expect. This isn't anything hard. A lot of this you can find on the internet, so it's not too big of a deal. But this is an example of one that Kaylin did last year over a labrum tear, which is in your shoulder. So just some basics, and I will have a rubric for y'all, so that way y'all know exactly what needs to go on there. But here you're going to have what the injury is, and you'll kind of talk a little bit about that. So here she talks about exactly what the labrum tear is, and even goes into different types of labrum tears. Her next slide is about the structures involved, so she kind of tells you a little bit more about what the actual structure is. If you were talking about any other kind of injury, maybe you want to talk about if there's like multiple bones or ligaments involved. This one's kind of straightforward, so it's not too big of a deal. Then you're going to go over whether it's acute or chronic. Hopefully you guys know the difference. If not, we can talk about that more later on. And then she also puts the causes on here. So foosh would be falling on outstretched hand, and has some different ones. This injury happens to be both acute and chronic, so she kind of talks a little bit about that as well. Then she goes into signs and symptoms, which you guys may feel or see with that injury. And then special tests. Special tests are going to be the tests that we as the clinicians actually do to kind of feel what's going on in there. These are not going to be your diagnostic. So it's not your x-ray or your MRI or anything like that. These are what we do hands-on to find out what's going on. Then you're going to talk about diagnostics. How can we actually pinpoint what's going on? Some things may be as simple as an x-ray. Some may need an MRI or CT scan. So here she talks about how an MRI is the most appropriate. And then she even talks about how sometimes they'll actually go in and check it out to see if it even needs to be repaired. Then there's treatment. What are some things we can do to make the situation better? And then, is it surgical? Some things are going to be, some things are not. This one is. Now, some people deal with it. And so she kind of talks about how if you're over the age of 40, it may not be too big of a deal. But that's going to be important. And then prevention. What can you do to prevent that injury from happening? And as always, we want some fun pictures. So here, Kaylin actually found how to do some of the special tests that we would do to determine what's going on. She even has some great pictures of what the labrum is and certain types of tears and the degrees. She even got fancy with it. And at the bottom here, I'm not sure if you can see it because I think the slides are in the way. But she actually got pictures from one of our recent kiddos that had this surgery done and got permission to use them, obviously without displaying their name. But that was kind of cool that she included that. So it's really simple. I'm not expecting you guys to do too much, but hopefully y'all can learn a little bit more about the body. We'll start with the head, and we'll basically go through each body part, and you guys will be able to pick which one y'all want to do. We'll talk a little bit more about it this week. Y'all will actually be choosing your first injury, and it'll be over the head. So there's a couple different options you can do there. Obviously, the biggest one is going to be concussion, but hopefully you guys can find something fun that will interest you. We will talk more tomorrow about the rubric, so don't freak out. I just kind of wanted to give you guys a example. If you have any questions, feel free to comment below, and we'll get ready.